Promotion by Laura McNichol, Unit 18. So what is health promotion? Health promotion campaigns are a public health approach with the key principle to encourage people to live healthier lives, avoid hazards, prevent or avoid disease, and improve their mental health, amongst other things. Health promotions and campaigns provide resources and information to aid the individual in taking steps towards an overall better quality of life. The thought behind a health promotion is that if people can improve their own health and well-being through small changes to their lifestyle, making better, more informed choices, or with support programs in place created via the campaign resources, this will in turn reduce pressure on the NHS, both financially and physically, in terms of resources and time, as well as reducing pressure on other services such as the police. For example, the popular Stop Smoking campaign and smoking cessation advice is the longest running public health promotion in the UK. It's helped people quit smoking, and in turn this has and will continue to reduce the strain on the NHS, as there will be less smoking related disease as time progresses due to people quitting or not even starting in the first place, which can be linked to the success of the campaign. So one campaign is Better Health, Every Mind Matters. Now the Better Health, Every Mind Matters campaign was launched by Public Health England and the NHS in October 2019 initially, following research that found 8 in 10, which is 83%, of people had experienced early signs of poor mental health in the 12 months prior, with 27% of those people waiting over 6 months before taking action to manage their mental health, with 74% of people actually wishing that they had done so sooner had resources been readily available. The campaign was further promoted and backed during the COVID-19 pandemic, as research conducted found that half of adults in England stated that the pandemic had had a negative effect on their mental health and well-being, with 57% of 18 to 34-year-olds stating that their mental health was negatively impacted, and 44% of those reported that they did not know how to help themselves. The promotion was described as groundbreaking, a new platform launched to support mental health by the UK government. The campaign is supported by a coalition of leading mental health charities such as Calm, the NHS, local authorities and various commercial third sector partners. The campaign is also backed by celebrities and influencers, including Stephen Fry, who stated at the time, "The last 18 months have presented us all with uniquely different and challenging obstacles from a mental health perspective. However, just like keeping in physical shape, it is important to find activities you enjoy to keep your mind healthy," which encouraged people to find what works for them, to support their mental health and well-being by directing them to free and practical tips and advice that they can answer 5 simple questions on the website or the app, which will give them a tailored mind plan. And the mind plan gives them free and personalised tips to help deal with stress, anxiety, boost their mood, promote better sleep and feel in control. Since the launch of the campaign, over 3.4 million mind plans have been created, and the campaign has been considered a resounding success. The effect of the campaign on the individual is improved mental health and well-being, self-management, quicker access to helpful resources and a better quality of life overall. The impact on society is that if people have the tools to self-manage, there will be less need for mental health related GP services and less risk of serious complications such as suicide and suicide attempts, with potentially catastrophic outcomes that could lead to a lifetime of care needs, and therefore saving the NHS time, money and resources, as well as reducing the strain on charities like Samaritans and also the police and fire services, who do need to intervene in suicide attempts. It'll also reduce waiting lists for therapies, and if less people get to the stage where they're needed, which will benefit people who are already on the waiting list. There will be more public knowledge and awareness of mental health issues, meaning that those who are suffering may feel better supported in the community, and if more people understand what they are going through. Another campaign is the Change for Life campaign. Now, the Change for Life campaign was launched in 2009 by Public Health England, and it was England's first social marketing programme aimed at combating obesity and the health issues that it causes. It's a fun and interactive way to get the whole family involved in making healthy choices and reducing childhood obesity levels, which was reaching crisis levels in 2009. The programme is set in 4 stages: to alert, to motivate, to support, and to sustain. It also promotes healthy habits like 5-a-day sugar swaps, get going every day, and 100-calorie snacks. The first year was deemed a resounding success. Brand awareness grew rapidly and public reactions were overwhelmingly positive, with over 1.9 million responses and 466 families signing up in the first year, and the campaign reaching a whopping 99% of targeted families in the first year. It was believed that after 6 months, 44,833 families were still involved. The campaign was so successful that in January 2010, a sister brand, Start for Life, was released, which published materials for parents of very young babies and children. And in February 2010, a further programme for adults in their 40s was launched. The impact of the individual of this campaign was a reduction in weight and weight health related conditions, illness and disease, a better understanding of nutrition, more confidence to live and eat well and healthily, and a better quality of life overall. The impact on society was addressing the high-profile health concern of obesity and the health challenges that brings, and with a reduction in the level of obesity and obesity-related health ailments, that naturally brought around a reduction in the financial cost to the NHS and government, and less appointments in primary and secondary care settings were used on obesity and the related conditions. The general effects of health promotion on the individual across all campaigns that are promoting better health, improving physical and mental health, reducing level of fitness and disease, enabling self-management and self-help, and aiding a better quality of life. The general effects on society are to address high-profile health and wellbeing concerns, to reduce strain on the NHS financially and physically, promote herd immunity through the vaccine programmes with the hope to reduce or eradicate the disease entirely. Some promotions can reduce crime through encouraging road safety, reducing alcohol binges, and reducing recreational drug use, which in turn reduces the need for NHS service involvement in alcohol and drug-related illness and injury, as well as reducing pressure on the police and fire forces by reducing drug and alcohol-related crime and accidents. So the health promotion that I have chosen to create is called Be True. It's an LGBTQIA+ health promotion. It is a health promotion effort to improve the health, well-being, and ultimately the quality of life of members of the LGBTQIA+ community, with a particular focus on adolescents and young adults. Be True will be a one-stop shop promotion for all members of the LGBTQIA community, with the main aims being to promote safe sex, reduce STIs, HIV and AIDS, provide information on coping with diagnosis and life after diagnosis, reduce mental health struggles, to help bullied individuals reach out for help and devise coping mechanisms, and provide resources and places to turn to with an aim to reduce self-harm, suicide rates, mental health problems, and drug use and addiction. There'll also be further resources to support coming out for the individual and also for families to learn to accept and to make their loved one feel accepted. There will be information on equality laws and rights, as well as linked charities and services for those who are experiencing or have experienced discrimination. There'll also be seasonal promotions, such as a safe travel guide highlighting the safe and not so safe countries to visit, as well as a huge push during Pride Month, which is in June, with an online interactive materials, events, groups, and there will be a presence of Be True at all Pride parades. Health-wise, there'll be vast amounts of information on transitioning, up-to-date information on gender dysphoria, NHS service wait times, and access to free, discreet sexual health checks that can be done at home in private, with results texted to patients via NHS Sexual Health 24, which is a service already in use. There will also be a campaign to run alongside the smear campaign of the NHS to encourage trans men to get their smears, with tips of how to deal with this essential health check without experiencing a major dysphoric spiral, which is a problem for a lot of trans men. As Be True grows as a campaign, it will be assessed and the services and resources added and removed where needed, depending on the levels of use. So the rationale for Be True will be from the perspective of the ecological model in relation to health promotion theory. The ecological model looks at influence across various levels, such as biological, interpersonal and intrapersonal, showing the interaction between and independence of factors within and across all levels of the individual's struggles and health issues, highlighting the individual's interactions with physical and socio-cultural environments. So intrapersonal or individual factors which influence health behaviours are relevant in relation to the Be True campaign, as it looks at knowledge, beliefs and attitudes and personality of the members of the community. So as members of the LGBTQIA community come from all different backgrounds, religions, cultures and societies, which have all had an impact on their knowledge, beliefs, personality and attitude. So some individuals may not accept that they are actually a member of this community and will feel shame, whereas others might be struggling with family and friends acceptance, amongst other things. Interpersonal factors could be interactions with others, which is important for the LGBTQIA, and therefore Be True as an LGBTQIA plus individual can have social support which can help them, or they could have barriers which stops interpersonal growth, and that ultimately promotes unhealthy behaviours rather than healthy behaviours. Institutional and organisational factors include rules, regulations, policies and informal structures that can constrain or promote healthy behaviours, which is an important factor when thinking about the health of the LGBTQIA community, as it's still not accepted in some cultures, religions and countries to be homosexual or transgender, which can have a huge effect on the LGBTQIA plus people, who can feel shame, they can hide away and not be true to themselves, causing poor mental health and even poor physical health. Community factors are also important to consider because that focuses on formal and informal social norms existing amongst communities, which can limit healthy behaviours, and as a large member of the LGBTQIA community are still ostracised from their own community or in some countries from society entirely, that limits their ability to seek healthcare for certain things and can also worsen their mental health. Public policy factors can also have effect due to LGBTQIA plus behaviours being illegal in some countries. Seeking healthcare in those countries would be impossible for gender reassignment surgery or to seek HIV and AIDS treatment, because the act to have transmitted that disease is in that country illegal, and to want to reassign your gender is illegal. How would I promote Be True? So I would promote Be True using the mass media approach to promotion, which provides information to the masses without focusing on an individual group. So although Be True is aimed at a specific group of people, and a smaller group session in the community would work well for future campaigns down the line, the initial campaign would be promoted to the masses, as it will reach more people, particularly those who are querying and questioning their sexuality or their gender, and those who don't have access to information and support in their own communities. The disadvantage to the approach is, of course, that it'll reach people who the information just doesn't apply to, nor appeal to for that matter. However, in turn, this could actually be a positive effect because it might reach someone who can pass on the information to someone who the campaign does apply to, and it can reach those who are unsure and questioning in a rapid manner. Be True would be promoted on the radio, television, in schools, universities, GP practices, on billboards, on the sides of buses, particularly the Pride buses in Newcastle upon Tyne under the Go North East branch of bus service, and I would also look to promote on posters in gay bars and in nightclubs, as well as having a large presence at all Pride events up and down the country. I would also promote heavily online, particularly on social media platforms like Twitter, TikTok, Facebook and Instagram. Talking of Instagram, here are some examples of interactive Instagram stories posts that I've created, which could be shared on the Be True Instagram page, with the hope that people will swipe up and click the link to the website for support and information. The same posts could be shared on Facebook and Twitter. The stories would also provide a download link for the Be True app, which would have many interactive features and a lot of information for LGBTQIA plus individuals, with access to resources, support groups, community groups, and tons of real life experience stories with positive outcomes. For further promotion, I would like to get celebrities and influencers to back the promotion on their own social media outlets, as well as doing a monthly social media takeover where an LGBTQIA celeb or influencer takes over Instagram for 1 hour a month for Q&A and posts, as well as a monthly blog post and a monthly appearance on the Be True podcast, which will run weekly with regular hosts, with celebrity hosts once a month if possible, just throughout the campaign months. In terms of the campaign months, I'd like to spend 9 months collating data and statistics to properly assess what the community needs, and I would like to spend a further 3 months ensuring that the app and the campaign materials were effective and cater to all of the needs of the community. I would like to start the campaign in June to coincide with Pride Month, with a heavy mass promotion during this month, as it's the month for LGBTQIA plus community awareness, support and pride, which Be True is obviously a huge advocate for. I would like to have the campaign running until October, as I would want the campaign to have a resurge around the back to school time, for back to school week and then for the University Freshers Week, as that's a time for stress and upheaval for most people, particularly LGBTQIA plus young people who may have moved school or university and have to go through the coming out process all over again, and they might encounter new challenges with their new environment. And finally, a way to assess the effectiveness of the promotion, I would measure the effectiveness of Be True through a full evaluation, which would be written prior to the release of the health promotion, and it would be referred back to after the launch, and then again after completion of the first campaign, so in the October, for a thorough and accurate evaluation. Some aspects of the evaluation would be to monitor how many people have downloaded the app, then to see how many were still active at it on the app at the end of the promotion. I'd also monitor hits on social media like views, clicks and other interactions, as well as running a survey amongst the users, an online survey, to determine what they do like about the promotion, what they don't like, and what we could do better for the next campaign, which would start the following June, with an aim to run longer if the first campaign was a success.